problem is mainstream medicine in many ways is fragmented. It's this sort of go from specialist to specialist instead of realizing the body's interconnected. So it's a fragmented system that treats the body fragmented, and that's the problem. A lot of people fall through the cracks of that.
So today we have Will Cole on the podcast, who is a friend of mine and also a wonderful functional medicine doctor, and the first person to start telehealth 13 years ago.
Functional medicine telehealth clinic, yeah.
Before anybody else. And he now has his second book out called Gut Feelings. His first book was a New York Times bestseller.
So this is actually my fourth book.
What?
My second with Goop Press. Well, yeah, I go way back.
Holy moly. Okay, I thought this was your second book. What were your other two?
Before we knew each other.
That's
why.
true. Okay, what were the first two?
This is like before Jennifer life. It's
exactly.
like a different era.
A totally different era. That's why I have no idea. And probably you don't either. No, I'm kidding. What would
Ketotarian, actually, I think to this date sold the most. Ketotarian was the first book.
Oh, that's right.
And the second is The Inflammation Spectrum, which people love that book. Third was Intuitive Fasting, and now Gut Feelings is out of all my book babies. This is my favorite one.
Really?
Yeah.
So these two, the last two were on Goop Press. Who were the other ones on?
Still under Penguin Random House.
Okay.
But under Avery. So you know how the book world works. So it's like these imprints within imprints. But there's Penguin Random House and then Avery. Now I'm with Penguin Random House, Rodale, Goop Press.
Okay, so you had. Because I thought the last book before Gut Feelings, that was a New York Times bestseller.
Yes, it was.
So the two prior, were those also?
They were not. They were all the other ones, like the
USA Today, yeah,
and Wall Street, Canada. I did big in Canada.
I'm Canadian. I like that. Okay, yes.
Yeah, but it didn't hit the list. But you know how those things work too. It actually sold more than the book that made the Times list.
Isn't that crazy how that works? That's literally a whole other podcast.
Yes.
I mean, we can sit here
It's
all
curated.
day.
Let's just say it's lovingly curated.
Lovingly? I wouldn't use that word, but okay, we'll use that adjective because you're much more PC than I am.
Subjectively curated.
Subjectively curated. I love that.
Yeah.
I love this book, this new one, because it was very much tied with obviously emotions and how your emotions. I was like very interested in understanding and learning like your nervous system with your gut health, your mood, your depression, with how that affects you. But you went like in the weeds a little bit more than the topical that I've seen other people talk about.
Yeah,
we all hear your gut is your second brain, or we all hear that stress can be very harmful for your health. But what I like is like you go from emotion to emotion, which I thought was so interesting, and I really enjoyed it.
Thank you. Well, I mean, you're right about that. The conversations around the gut and the brain, I've been talking about it for 13 years. So there would be no reason for me to write a book about that, because I've written hundreds of articles about that. But I really wanted to get deep, like I've never done before, in a sort of literary way.
Yeah.
Talk about the things that I see play out in people's lives as far as my patients are concerned, and delving into these complex issues of chronic stress and trauma and intergenerational trauma. These are big things.
Totally.
But the science is just so compelling of how these things can literally be stored in our cells, dysregulating our nervous system, raising inflammation levels, impacting hormones. I look at labs all day long, so I see it play out in both the gut and the feeling side of it, the physical, and then this mental, emotional, spiritual component of it. It's a both and conversation when you're talking about mental health issues,
right? And
when you're talking about autoimmune issues. And those are my people that are looking to reclaim their health from these things that are really keeping them down.
It's also like the whole trauma piece of it too, right? Like how that really does impact your health.
Yeah.
And what's interesting, like you talk about this a lot in your book, that regular medicine does not even like touch on this at all.
Yeah.
I mean, and you'd think after so many years and like, and now like the evolution of where we are in the health space, that it would kind of take a piece of it. Why has it not at all been, it's never even broached if you go to a regular MD?
Well, I think in many ways, when you're looking at chronic health problems, it's really a chronic health problem management issue, right? Because it's not just about the trauma piece. It's about really all the underlying components that researchers are looking as to what's even triggering all of these problems. Like, why do we have this epidemic of autoimmune issues and mental health issues? Why? And they're not really, researchers are looking at it, and the trickle down effect of when it hits sort of the mainstream. This is a conversation I'm having with my PCP, my GP, my endocrinologist, my rheumatologist. It just takes so long, and there's so much red tape. The problem is mainstream medicine in many ways is fragmented.
It's true. It is.
It's the sort of go from specialist to specialist instead of realizing the body's interconnected. So it's a fragmented system that treats the body fragmented. And that's the problem. A lot of people fall through the cracks of that. I mean, most of my patients, when they meet me, they're extremely compliant people. They're well-read, they're erudite, and they're compliant, meaning they want to do what their doctor is telling them to do.
Right.
And they are doing and have done it, but they're spinning their wheels because they aren't seeing the answers. So some people certainly, and I know both know, there are people that are helped by the system. There's nothing, I'm not making broad sweeping statements.
No.
Some people are helped, but then you have to look at the countless of people that are, maybe it's a piece of their puzzle, but it's still not getting them to optimal wellness. Maybe it's managing some symptoms, or as I hear oftentimes from people, like taking the edge off of some of their symptoms, whether, autoimmune issues or mental health issues, but it's not dealing with the breadth of things that are underneath the ocean, to use that, tip of the iceberg analogy.
Yeah.
They're just scraping the surface.
Well, I'm always curious, like, when do you know, like, as a patient, as a person, when it is something that's much more traumatic, like something that you're dealing with emotionally, traumatically, or whatever, versus if it's actually just because it is this thing. Like, for example, okay, I have eczema, right? How do I know if it's just because I was born with a bad skin issue and that's what it is, versus like there's something deep seated that I don't even know, or maybe I'm dealing with something that I'm not even aware of that's causing the root cause of it?
Yeah. So in my clinical world, it starts with a health history and really getting deep. I mean, we're talking about a very comprehensive, granular, in-depth questioning and learning, and this sort of like holding space for all of these sort of intricate variables that maybe seem inconsequential to the person.
Right.
But for us, these are clues or clinical pearls as to things we need to be investigating.
Okay.
And then labs, I think, would be illuminating too. But some of the questionnaires that we ask, if you're thinking about, okay, is it physiological or is it mental, emotional, spiritual? And typically it's going to be a confluence of both.
Say the difference, because for people who don't know.
Sure. So physical, and the book is really an exploration of this bidirectional relationship between gut and feelings, or the physical and the mental, emotional, spiritual. So when I say physiological, some examples of that are going to be underlying gut problems, or dysbiosis, or leaky gut syndrome, or some sort of fungal overgrowth. That's an example. Or a nutrient deficiency would be another example. Or a hormonal imbalance would be another example. Or some sort of chronic infection. We see a lot of mold toxicity, mycotoxins, and chronic Lyme disease. Those are physiological things that will raise inflammation levels in the body, which will impact many things, depending on who you're talking to. For people that are going through anxiety and depression, brain fog, fatigue, neurological issues, all of those things I just mentioned are associated in the research with triggering neuroinflammation.
Right.
And for people with autoimmune issues, it's somewhere else. If it's autoimmune thyroid issues, it's against the thyroid, or if it's just some general metabolic issues, like I have trouble losing weight, all of those things I mentioned can impact blood sugar and your insulin resistance, which will make it really difficult to lose weight and give you a lot of blood sugar metabolism problems. That's just the physiological stuff, or the gut stuff that I talk about in the book. The feeling stuff, like chronic stress, shame, trauma, those things are just as much influencing inflammation levels in all of those areas. So it's, again, this both and conversation around these, I used the analogy of these junk food for the soul in some ways, like these junk foods that are metaphysical, that are impacting the physical quite profoundly. So how do you know that? It's getting to know somebody, and then for the person that's listening to this, getting to know yourself, getting inquisitive, and start to delving into these deeper layers that I teach about in the book. And in lieu of me being there, like if I'm not your functional medicine doctor, that's why I wrote the book, is for you to learn a functional medicine approach, to say, how, like, is trauma a piece of my puzzle? is an underlying gut problem a piece of my puzzle? Is it a bit of both? And then they can start to learn and lean into these protocols that I've seen really be effective for people to start to untangle these quite entangled things.
Well, you just said it right here. I wanted to ask you about shame
Hmm.
because you just mentioned it. Like shame, you said, is the most damaging emotion
Hmm.
in the world, and it can cause so many like health problems.
Yeah.
And like you never even think of, you can think of these other things, but so can you say two things? So what usually correlates with shame? Is there like certain illnesses or health issues that usually you feel that shame is like the root cause? So people can say, oh, maybe I'm feeling this way
Hmm.
because, you know what I mean? To kind
Yeah.
of for themselves to kind of not self-diagnose, but
Hmm.
have more understanding.
Yeah. Well, I think shame is a common emotion that is associated with things like trauma, and a common emotion that's associated with stress. Like I know a lot of patients that are stressed out with work and their family, and they feel like they're just not good enough. Like they don't have the bandwidth to do the things they want to
Mm.
do, and they feel like a failure. And then there's a lot of health related shame, like shame around people's bodies, around food. So what I call in the book shameflammation is really sort
Yeah.
of the confluence of the chronic stress and trauma piece of how it's playing out in people's lives, and they feel varying degrees of shame because of the sort of, it's the aspect of the autonomic nervous system being overactive for too long. That sympathetic fight or flight, stressed, inflamed state is just always going in perpetuity to varying degrees for people. That's
Right.
the problem. So how people can know about it, it's just, I think, being more mindful and looking at how you feel. I think some people just are on autopilot so much of their life. They know their health could be better, or they know their health is really in the gutter, but they don't. They're always our culture distraction so embedded in our culture, and it's like designed that way today, right? And on top of that, people just live busy lives, and they months turn into years, and years turn into decades for some people, of just like, dang, I should have dealt with this a long time ago, but I see it snowballing. And to varying degrees, people start to have these wake up calls to know they have to do something different, to see something different. But shame is an integral part to many people's health puzzle and to dealing with that. So like the practices of self-compassion that I talk about in the book are just so powerful to modulate the nervous system and the immune system, i.e. lowering inflammation. It's not sexy so much, right?
Yeah.
It's not. But self-compassion is sexy. That's what I'm trying to do with this book. I'm trying to
Make it
rebrand
sexy.
self-compassion.
To make it sexy.
Yes, that's right.
I love it. Okay, so that's the what is the definition of shameflation? Shameflation. Is that the
Shameflammation.
Shameflammation
I'm amalgamating shame and
and
inflammation.
inflammation
Yeah.
together.
But you're not the only person when they first see that made up word that I made up. You're like, what does this even mean?
I had to read it like 100 times. I'm like, shame. I have it written down as shameflation, but how do you say it?
Shameflammation.
Shameflammation. Okay, that's hilarious because it's a great name though. So that is basically what is really a lot of times sabotaging our overall health, right?
Yeah, it's the feeling side of that gut feeling puzzle. So it's not the only one, but it's that if you're talking about that bi-directional relationship, that's going to be a major part. That shameflammation, meaning that mental, emotional, spiritual component. How are things like that, like stress, shame, and trauma, impacting my physical health? And the research is very clear that these mental, emotional, spiritual things that aren't serving us are literally stored in our cells. Our body, it's made up of trillions of cells, is a cellular library. It's keeping all of the thoughts and the words and emotions and trauma accumulated over time. And in some people, it's kind of, they've hit that tipping point where it's expressing itself in the form of anxiety and depression and autoimmune issues or metabolic issues. So it's really vast as far as its implication and why people should care about this.
Yeah.
I mean, even if you think about the hormonal problems that people see, oftentimes it's that what I call shameflammation, that mental, emotional, spiritual component that is contributing to, at the very least, if not completely causing it for many people.
So then how do people get better really? Like if they still are dealing with those feelings, right? Even if they go see you or whatever, you do all these tests on them. how do people even heal those things without, like, that's a lot of, like, is that a lot of therapy? Like, is it how do people get better
Yeah.
if this is the root cause?
Yeah.
And it's not just taking a pill or not just doing X, Y, and Z.
Yeah. And I love that you said Zed. I love Canadians.
I know. It's like it came out. Whoops. I was
Don't
trying
take it back.
I will
please.
never. Don't you worry.
Don't
Z.
Don't let LA take the
Oh,
Canadian out of you.
You can't take. You could take the small town, the small town girl, or what was it? Like you could take the girl out of the small town, but not the small town out of the girl.
Speaking to a small town guy who still lives in the small town.
Exactly. And that's why I like you so much.
That's right.
You haven't
small
changed.
Town people have this affinity. That's right.
Totally. It's like, I see you.
That's right. So what do people do? It's big. It's a big, complex thing, but that's really what I'm delving into in the book, because there's a protocol in the book that really goes, it spans over 21 days.
Yeah. It's by the way, it's a 21-day gut feeling plan.
To teach people every day what to practice. Because it's not, as I say in the book, this is not, if you're talking about trauma, you're not going to heal all trauma in 21 days. But what I want you to do is to start to learn what are the most well-researched, the most effective, in my experience, seeing patients for the past 13 years, ways to start to reconnect that gut feeling connection, start to regulate the nervous system, start to lower inflammation levels effectively. So these are just basically 42 of my favorite tools that I put in patients' protocols. 21 gut action items and 21 feeling action item. So in the gut stuff, it could be, I talk about a GAPS protocol in the book, which is an acronym that stands for gut and psychology syndrome, or gut and physiology syndrome, either one. And it's a way to use food to sort of nourish the gut, the second brain, calm inflammation levels, and support that vagus nerve, which innervates the gut and the brain. And a feeling action item could be, I talk about breathwork and the power of different breathwork techniques. And one, Solomon, I actually did it the other day together. My son's here in the studio.
On his phone. He's like bored as hell already. I don't blame him. He's 16. He's listening to this probably for the 400th time.
No, this is a completely different conversation, by the way. It's like, you're one of the best. I've told you this the other times we've talked. You're one of the best interviewers that I've ever been on.
Really?
I told you that
you
last
did
time.
Tell me that. Why? That's so nice. Why is that? I'm curious.
I don't know, because everybody and their mom has a podcast these days.
It's true.
And it doesn't mean they're talented. They may have a following, but it's not necessarily, it would never get picked up on, like, if it was an actual business.
Exactly.
But yours could. And I think that there's an art to it and a skill set to it that not everybody has.
I love you for that. Will, we're going to cut that into a teaser. Will is going to put it on his social media page. We're going to send it into every network. That's fair. No, I'm joking. That was so nice. I appreciate you saying that. It actually means a lot, because I agree. Like, everyone and their mom and their dog and their cousin now thinks, well, podcasts are hot. Let me just try it out and do one. And they're like, they don't research, they don't prepare, they don't know how to even have a conversation.
That's true. We show up to some, I'm like, what the heck?
It's bare. I mean, even with, I'm actually offended if I go somewhere and they're like, so what's your, like, tell me about your book. It's like, are you serious? You didn't even you didn't respect me even that much just to read the first page, or even whatever it is. Like, I find that to be so insulting, but anyway, that's the majority of people, right? I hate to say it. So the fact that you recognize that, it makes me very happy. Thank you.
It is noticed for sure.
Thank you.
But I mean, so it's these gut and the feeling action items are just
go ahead.
Back to that gut health thing. Sorry, everybody. So I don't know. It could look like breath work. That's where I lost my train of thought.
All right. You need to meditate next time.
We did a holotropic breath work, him and I, with this group, and it's a great way to sort of metabolize stored
What is
stress
that?
and
Say
trauma.
what it is.
It is a sort of, I would call it a more advanced breath work.
Solomon did it too. You did it too? Okay, cool.
Yeah, he meditates as a general rule.
This is a 16-year-old going on 34, but
yes, he is.
It really is.
Pretty much. And so it's a great way to strengthen the vagus nerve, which is, again, largest cranial nerve in the body. And it's really one of the main governors or components to the parasympathetic aspect of our nervous system.
Well, tell people, because I know you say it like everyone knows, and I understand this, but for people who are listening, because you talk about this a lot in the book, the vagus, you call it even the vagal tone. What is it?
Vagal tone, yeah.
Yeah. Explain all this and how it all connects together.
So breath work and just like basically all 42 of these tools that I talk about in the book are all meant to support the parasympathetic nervous system. And part of that is improving vagal tone. So the vagus nerve, longest cranial nerve in the body, it comes from the word which translates to wandering or wanderer. So sort of this long nerve that's connecting the gut and the brain. And we mentioned this, like we're assuming that people know, but like the gut and brain are formed from the same fetal tissue. So when babies are growing in their mother's womb, they're formed from that same fetal tissue, and they're linked for the rest of our life through what's known as the gut-brain axis in the research. Well, the gut-brain axis is in part what they're talking about there is the vagus nerve.
Right. Okay.
So the most people, because of when you're talking about the autonomic nervous system, and I mentioned the parasympathetic vagus nerve, rest, digest, hormone balanced, calm. The sympathetic, the fight or flight stressed aspect of the autonomic nervous system is overactive, i.e. inflammation, mental health issues, autoimmune issues. So we have this sort of seesaw effect of the autonomic nervous system. Most people are overactive in the sympathetic and underactive in the parasympathetic. So what we're trying to do is regulate the nervous system or modulate the nervous system in a way where both can operate optimally. You don't have a hypervigilance in sympathetic, and you don't have sort of a lack of any resilience in the parasympathetic. So when I say poor vagal tone, that's associated in the research to just about every chronic health problem, autoimmune issues, mental health issues,
super
digestive
active
problems,
very overactive in the sympathetic area.
Yeah.
Now you're saying in your like breath work, the kind we're going to talk, the one you just mentioned that you did with your son, breath work, stuff like another thing. You have a lot of somatic
practices
in there that help equalize the sympathetic and the parasympathetic. Is that basically?
Yeah, they're basically like, yes, it's a nervous system workout in many ways.
Yeah.
It's like a nervous system and vagal nerve workout.
So that's really interesting, because when you said that about the overactive, like all those things, I feel like you described me and probably a lot of people who are listening. And I always say, oh, I hate breath work. I hate meditation. I'm not good at it. I don't want to do it. And so I don't. And so that's probably why then you go more all in on the things that you're good at, which are much more, again, intense and hardcore and high intense training. But that's just making it worse, right? Because you're not balancing it.
Yeah, it can. And that's why the yin and the yang, they're both important.
Super important.
And you don't want to forget the other. And it is not as, especially in our culture where it's so exterior in that way, right? It's
totally.
The things you notice, you change the way you look and you can look better.
And you sweat, you can feel it.
Exactly. And these sort of things that are, like I call them acts of stillness, they're not as sexy in our culture. And I'm trying to rebrand
You're going to make it sexy again.
But like breath work is a great way to work out your vagus nerve, work out your nervous system, work out your autonomic nervous system to start to, and not just work it out, but actually cathartically metabolize and clear out things that are stored in your cells, like trauma in your life, but even your ancestors' life, like that you're passed down through generations.
Okay, so what you just said that you guys did a special kind of breath work. What was that called?
Holotropic.
Okay, what is that?
Holotropic, it's a type of breath work. I talk about it in the book. It's the advanced breath work section. That's
the page I skipped through.
You're like, and no.
Yes. Told you, not liking this part right there.
So it is just I would say you breathe the way that we have done it. You breathe through your mouth and in and out, in from your mouth and out of your mouth. You're not really doing any nasal breathing, which has its place. I mean, right, we do a lot of like mouth taping for patients to like get their proper sleep at night and not.
Do you believe in that, by the way?
Oh, absolutely.
Really? Okay.
Any patient that has dysregulated sleep-wake cycle, looking at cortisol and melatonin on labs, mouth taping can be a great way to optimize sleep. And somebody's waking up lethargic, or even I see a lot of people that they say, oh, I sleep fine. But you look at their Oura Ring or their Whoop band or their labs, and it's like not good. Their REM and their deep sleep are just in the gutter. And mouth taping can be a game changer, amongst many other things.
Do you do that?
I don't, but my sleep scores are pretty good. We're in competition normally, Solomon and I, but
Yeah. Who
he's
wins?
normally better than me, but
Yeah. Well, he's also 16 years
16,
old.
yeah.
Yeah.
And he has less things on his plate.
Exactly. You think? Really? A
Yeah,
16-year-old?
just slightly.
Although you
He
put him
thinks
to
he's
work.
maxed out.
I was gonna say he works for him. He like runs his like social media or
Yeah.
does something. I don't know. Like it's a 16-year-old employee of yours.
Yeah, he does. He's part-time. He's an intern. He's an
He's
intern.
an intern. Okay, I like that.
Yeah.
Okay.
So basically, I'll tell you the history around holotropic breath work. It was used as an alternative to elicit similar experiences as psychedelics.
Oh, really?
Yeah. So you can have a very similar experience from holotropic breath work as you can from psychedelics. And just with cellular,
How?
because of the oxygen and the gases of that you're kind of modulating with your breath to impact certain centers of the brain and the nervous system to elicit this sort of ecstatic experience or psychedelic experience. But just like with psychedelics, you can dose differently people are microdosing psychedelics. You
Yeah.
don't get a full, trip. You can do the same with breath work. You can slow it down. The breaks are breathing through your nose. It kind of slows it down. So you can self-pace this for yourself. And not everybody has to have the same experience because there's many types of breath work. Holotropic is just one path for people to
But
try.
what makes it more advanced? Because you're breathing from your mouth, like
Because
all
you're
that.
having more of I would say, a somatic experience.
So let me ask you something, because I've been to a couple of these retreats and things where they put you in this room to do breath work. And, to your point, a lot of these people are having like these crazy like meltdowns or crying and having these like psychedelic type of reactions. And I'm literally sitting there like looking around, nothing. And it's like, it's embarrassing. I'm like, my eyes are open, everyone's eyes are closed. I'm looking to see who's doing what. Like, what happens for people? I'm asking for a friend, for those people who cannot shut their brain and like their ability to even get to a place where they can even try these things.
Look,
like these type A personalities,
yeah.
Like a friend of mine. What do they do?
Well, tell your friend. I would say that the reality is none of us are really good at it. Some of us.
You seem like you're pretty good.
No, I'm not. Some of us are better than others, but I think we're all really sucky at it, which is why we need to do it. And
so true.
That's why they call it a practice, right?
Right.
And it's like if we went to the gym and I went to the gym one time and I'm like, I'm not good at it. I've never been to the gym before. And I'm like, the gym's not for me. It's like, well, no, it's like, I just suck at working out and I have some weak biceps and I need to strengthen it. And that's what we're doing with breath work and meditation, is strengthening that mindfulness muscle. And the people that typically say that, which I would say, your friend is saying that right now, typically are the ones that need to do it the most.
100%. I totally agree with, and that's why my friend tries it all the time, goes to these things and tries meditation and tries all these other practices like the breath work that you're mentioning, and eyes wide open, not able to even like concentrate for 3 seconds enough to even like do it, for a time where they can get potentially even a little better.
And here's the deal with this, is that our mind, that sort of perfectionist, type A mind that you mentioned, that we all have to varying degrees, we see that as failure, or I'm not doing it right.
That's shame.
Right, that's shame. But really realize that we can actually use that distraction thoughts as a meditation too. And like the analogy that's used is like seeing and ultimately realizing that we aren't our thoughts and emotions. We are the observing presence of them. And you start to be that awareness around the thoughts and see them passing by. Like the analogy that I use, the book that many meditation speakers talk about, is like seeing your thoughts as clouds that pass by, and see yourself and realize, oh, wow, I'm this vast sky, not the clouds. Then you have a bit of a humor and lightness and grace to the whole process.
Yeah, exactly.
And realize, okay, this is just where I'm at right now. And it's going to be sort of these rapid torrent of thoughts as we are beginners in these practices, but then can start to strengthen that resilience around meditation.
So what other practices, you talk about the 42, that people can do in the 21-day plan to help heal themselves?
Yeah. So on the feeling stuff, if we're talking about that, different meditation, like beyond breath work, like body scans and present moment awareness and mindfulness meditations, mantra meditations, like loving kindness meditations. I
You believe in the mantras?
Yeah, absolutely. It's
Okay.
it's, I don't want to say believe, but I think that there's some compelling science,
Yeah.
and I think it could be a good entry point for people that it resonates with. So when
Gotcha.
I talk about these 42 things, I'm not saying everybody has to do these 42 things all the time. That's
Right.
not it. But I want you to explore and experiment, because again, I'm not there as your functional medicine doctor. I mean, many of my patients will read the book too. Hopefully all of them will.
Yeah.
but but ultimately it's going to be for the person, the reader, to say what resonates with me.
Mhm.
What really, like, oh yeah, I'm going to try that. And when to that meditation's not for me sort of thing that your friend keeps saying.
Yeah. My friend's so
She's, I mean,
close-minded.
you know what? We need to talk to her.
I know. Look, I
Is-
would to call you.
yeah, I would set up a consult, telehealth consult. But the reality is that maybe that type of meditation isn't for you,
Right.
Maybe it's like not resonating with you. Like the best type of meditation is the one that you can stay consistent with, and you are excited about, or at least able to
do
keep
the well, you even
Do the
say it in
work.
the book, which I always say too, which is why I laughed, is that like if you hate doing something, then don't do it. Like do something different. You know
Yeah.
what I mean? Like that's also a source of like a lot of angst and like, not good on the emotional side, right? When you're
No.
forcing yourself to like do something because you think you should all the time.
Yeah.
Is pretty much like bad for your health overall,
Yeah,
right?
stressing about meditation, stressing about healthy foods isn't good for your health. That's all shameflammation that I'm trying to like undo. For you.
Well, it's funny because even like we were saying earlier about the sleep trackers with the Aura and Whoop and all these things, like I feel, and tell me what you think, that with like all what's happening with technology, like we're like gamifying all these things for our health to like biohack ourselves to live to 180.
Mhm.
Now, isn't that in itself just super stressful?
For the average person, yes, it is. I would agree with that wholeheartedly. For many of our patients, we have them do it for specific periods of time
Right.
if they have a health issue. So we're
Right.
not just looking for problems just to like find them or like obsess about something just for the sake of it. The context is, let's learn and get some data points for
Right.
you and put it in context with how you're feeling, and can we make action steps as far as your protocol is concerned.
Right.
And then drop it. Like at a certain point, we're optimizing things. If we're doing our job, or if the person like that's reading the book, if these things are working, then at a certain point you can simplify your life. And I think the bandwidth for most people, they don't want to have to keep looking at all these data points. And I do feel like the data points at some point in the earlier in their journey, or when they do need to check in on themselves, when you get that feedback and know when I feel like this, my numbers tend to be like this, then it becomes intuitive and mindful. So it almost use those biohacking, like tracking things, just like you would maybe a diet tracking app for
Right.
sometimes.
For analytics a little bit to know what's going on.
And then drop it. If you're truly like a biohacker, and some people just really get excited about it, and it's not a source of stress or shame at all, then keep doing it.
Right.
But I think for the average consumer out there, it's something to check in, but I'll not necessarily have to use all the time. So meditations, some of the other tools, I'll talk about Shinrin-yoku, which is forest bathing, the research out of...
Talk about the forest bathing. I had that as a note, like ask him about forest bathing.
No, it's not taking a bath out in the forest.
That's why I was like, kind of like, what is this thing?
Yeah, how weird is this guy going to get?
Yes, exactly.
Yeah, but it's a Japanese translation that translates literally into forest bathing, which I think is a beautiful description of what they're saying in the original Japanese. It's using nature immersively as a meditation and using nature as a medicine. So therapeutically, it's going to be supporting that parasympathetic aspect of the nervous system. So it's multifactorial because you're taking it in. It's a sensorial experience. So taking nature in with your eyesight and the sounds and the stillness of it all, but also the smell of it all, like the essential oils from nature.
So what do? Give me an example. Tell people what it is, really.
So you walk very slowly within nature, and you just take it in. It's very simple. So it's like if you may only get a few feet within 20, 30 minutes, but it's just taking it in, looking and observing.
Oh.
So instead of it being about the destination, it's about the whole process of it.
And it's slowly going through that
Yeah.
process.
Or you could even sit in it. You don't even need to move. You could just sit and just taking it in. What our ancestors would just call life, we now have a term for it and randomized controlled trials for it. But now we know the exciting mechanisms of it. Like these essential oils have been shown to lower inflammation and boost mood and regulate our nervous system. And there was this one study that I talked about in the book where these kids, there was a group of kids that did it in this study that the study was looking at kids in forest bathing and how it impacted their health. And the participants in the study actually improved their microbiome because they're breathing in nature's microbiome, which is just so profound. Again, this is where 95% of serotonin is made, 50% of dopamine is made in the gut. So the gut is the second brain. So we're just beginning to understand the mechanisms of how we all intuitively know, yeah, getting out in nature, creating some stillness in your life is good for health, but how? Now we know these essential oils and the actual science of nature is really beneficial to our health.
Would also, can you include in forest bathing then getting a big one is going outside for the first 10 minutes and getting some 10 minutes of sunlight, vitamin D. Another one is like grounding, putting your feet on grass, whatever. Would that be considered forest bathing?
It would be. I wouldn't. I don't think the researchers around forest bathing would call it forest bathing, but in a way, you really are tapping into the same mechanisms. Yeah, because it's really centered around the same thing. I don't think that's how the researchers were doing it in the specific studies, but yes, any green space you can get, any time you can get out. So if you just call it grounding and you're not really going through nature, just in your backyard, it's still a very, very effective tool to literally modulate your nervous system in a positive way.
Okay, so can you tell me a few of the biggest health gut issues that people come to you for? The top three.
So, I mean, leaky gut syndrome is ubiquitous.
Yeah.
I mean, to varying degrees, it's really a common thing, but not a normal thing within the modern human experience.
Well, what are the symptoms? Like maybe someone has it and they don't even know it's called leaky gut.
And most people don't even know because you don't necessarily have to have extreme digestive symptoms to have underlying gut components to it. So they may be going to the bathroom just fine,
right?
But it's the systemic inflammatory component that's impacting it.
Got it.
So mental health issues, you look at the epidemic of what's going on there: anxiety, depression. Depression is the leading cause of disability worldwide.
I know.
I think 40 million Americans have anxiety, and that's just the diagnosable ones, let alone the spectrum of mental health issues that we face as a society, of this sort of background anxiety, this sort of low-grade, wired and tired feeling that many people have. These are in part inflammatory, if not exclusively inflammatory for most people. This isn't just my opinion of it. This is very well researched. It's called the cytokine model of cognitive function. Cytokines are pro-inflammatory cells. Researchers looking at how does inflammation impact how my brain works. Well, most of the inflammation, 75% of it, is made in the gut and stored in the gut. And I mentioned earlier how things like serotonin and dopamine are made in the gut, stored in the gut too, of which many antidepressants work upon, and theoretically serotonin, which is, a different conversation, but flimsy science at best anyways, because it's really the inflammation, in my opinion, and what most of us that are looking at the research is pointing to. It's really inflammation that is causing any dysregulation of neurotransmitters, and that's really the thing that we're trying to optimize for people.
So does that mean if you're depressed, does that cause inflammation, or inflammation causes depression?
And it's both for people, right? And that's sort of the bidirectional aspect of it, right? So first and foremost, it's a causation of it for many people, meaning there's underlying gut components like bacterial imbalances that, for one study that I mentioned in the book, that lower levels of these beneficial lactobacillus and bifidobacteria and bacteria are causing anxiety and depression because of how they are producing metabolites that then crosstalk with the brain and produce optimal brain function and mood. So inflammation, we know, causes anxiety and depression and I would say brain fog and fatigue for most people. It's multifactorial, right? There are other components to it, like situational issues as
Right.
well. But for many people, the physiological component of what the commonality is chronic inflammation.
Right.
But to your point, when people then feel depressed, that creates a bigger cascade. It becomes this negative feedback loop because
Yeah.
then they're stressed and depressed about not feeling well. And it's like this big vicious cycle of that we need to break, right?
And so you say this in the book, and this is something that I know, but I think it's very important to mention that exercise has been shown over time, and this is not just flimsy science,
Yeah.
way better than any antidepressant on the market, bar none,
Yeah.
for helping lowering all that stuff, right?
Absolutely.
Yeah. And like these are something that we can do our own without going on medications. Okay, so name a couple other ones. So leaky gut
Oh
was
yeah, so
one.
leaky gut syndrome, which we can quantify in labs. You can measure the protein called zonulin and occludin, which are the proteins that govern your gut lining permeability. So through a blood test, stool test, you can quantify these things. SIBO would be another major one that we see clinically.
I hear everyone talking about that lately. I've never heard it in my life until like 6 months, a year ago.
Yeah, we've been talking about it for 13 plus years in functional medicine. But I think to your point, I'm actually in some ways happy about it like becoming more and more mainstream and people aware of it because it's not a new thing. I think it's happening more and more because I think digestive problems, gut health problems, i.e., gut microbiome problems, because of the damage that we're having to all the bacteria in our gut. That's a problem. So it's a lack of homeostasis in the microbiome.
Yes.
So we have a lot of opportunistic or even normal bacteria sometimes growing where it shouldn't be growing into the small intestines, which is what SIBO is actually described as. It's not necessarily any opportunistic or pathogenic bacteria. It's quote unquote good bacteria growing where it shouldn't be growing.
So what are symptoms of that, and how does that even happen?
SIBO is the underlying cause of most IBS cases.
Okay.
At least a big chunk of them. I think it's 40 to 60%.
Oh, wow.
So it's the vast majority of people that have irritable bowel syndrome, the underlying cause of that is SIBO, small intestinal bacterial
Wow.
overgrowth. So it's kind of like weeds overgrowing in this gut garden where there's nothing wrong with the weeds, they're part of nature, but you don't want them overgrowing and taking over the garden. And that's the analogy that's used with SIBO. So it's described, I mean, it could just look like IBS. It's also an underlying cause for many people's acid reflux, indigestion, GERD. It's also one of the leading causes of people. It's associated with different autoimmune issues, SIBO is. It doesn't necessarily mean you have an autoimmune condition. It's just saying that it is a lot of people with autoimmune conditions have SIBO because, again, 75% of the immune system is in the gut. And some researchers are even postulating that SIBO may have an autoimmune component in and of itself. Like, could SIBO be an actual GI inflammatory problem that's actually an autoimmune condition in and of itself? That's sort of early stuff. But we know very clear that if nothing else, it's associated with many different autoimmune issues. But it could look like someone may not even identify as having, IBS, but it could be uncomfortable bloating. That's a very common one. Women will say, I feel 9 months pregnant, but I'm not even pregnant.
Right.
Right.
It can be from SIBO? That can be from SIBO.
And most of the time it is.
Not from leaky gut.
Well, here's the thing is that you can have leaky gut syndrome and SIBO. It doesn't have to be one or the other.
Okay.
Most people with SIBO, I would assume, have leaky gut syndrome, but not everybody with leaky gut syndrome has SIBO.
God, this is so complicated. You need like a textbook to like refer back to.
Maybe that will be my 5th book.
I was going to say, like, please, because this is like, honestly, I need like notes taking for like this because it's so much information. The body, like, you know what I mean? Like, it's not, one doesn't necessarily mean the other, and this one doesn't. There's so many like intricate details.
It is.
And what's the third? And the other thing I was going to say is doing these 42 things that you talk about, could it help cure like these other things?
Oh, yeah.
By doing like the breath work. I'm going to get into the other stuff soon, right after this question about food things, because I think that's important too. But could, by them doing this 21-day gut feeling plan, help the leaky gut, the SIBO? What's the third one you said?
Well, I mean, there's so many, right? I mean,
there's so many.
If we could say, one that comes to mind would be candida overgrowth, Or if you could call it SIFO, as is the acronym, it's small intestinal fungal overgrowth. So it's just that someone can have bacterial overgrowth, they can have fungal overgrowth as well. Candida, nothing wrong with Candida albicans or any other types of Candida, but it's part of the human mycobiome, MYCO biome. It's all the beneficial yeast and fungus. Again, nothing inherently wrong with it. It's the overgrowth of it that's the problem.
So then, okay, what is with all this? Like everyone's like probiotic, probiotic. If you take a probiotic, or anyone takes it, is it beneficial? Can it help with a lot of these issues?
It can. You have to be judicious with probiotics, right?
There's so much information out there on
It's
probiotics.
so much.
It's so confusing. I'm so confused.
I know, and it's the wild west for many people.
It is.
It's like it's so many brands doing so many things.
And they all say that they're the ones that are the most special, that the ones that are most effective. How do you know that they're like, we have a special strain? No, we have a special strain.
Yeah.
We don't need to refrigerate ours because we're so much better than the other one. Like, and then we also have a prebiotic. I'm like, okay, I'm so confused. I'll just have Candida and live with it, because it's so confusing.
Yeah, and look, some people don't even need to go and buy a probiotic. Some people can just maybe start judiciously with like some fermented foods and try that. Like do kimchi or.
How does that help? What does that do?
It's the same thing. It's probiotics. You're getting beneficial bacteria in food form to support gut health. Because it basically, we think of probiotics or probiotic rich foods like kimchi or kefirs or sauerkraut or kombuchas as like grass seed. They're not like that as much as influencers of the economy of the microbiome. They basically encourage other bacteria to grow, basically creating a more hospitable environment.
But then if they're growing and we already have overgrowth, don't you get more overgrowth?
So that's why you have to be judicious with the SIBO component. So people that have SIBO, to getting a lot of fiber, like especially fermentable fibers and probiotics, it can work, but you have to be judicious. So there are certain colonies that tend to be more tolerated to people that have SIBO. We tend to go more towards the spore-based probiotics that just are less reactive and actually act in many ways as antibiotics, because probiotics are sort of, if it's agreeing with your body, they are regulators of the microbiome. So they actually will help to modulate some of these opportunistic and pathogenic bacteria. My advice for people that have SIBO, start off low and slow, test these things out. Obviously, when you have a functional medicine doctor, these things can be, the guesswork can be taken out of it.
So what kind would you, what would you recommend in terms of you don't have a probiotic. You should, by the way. Oh, you do?
We do, yeah.
You never promote it.
I know, I don't. I'm a horrible businessman when it comes to supplements.
I mean, it's actually endearing because then you're not like plugging like just like a product.
Yeah.
But I mean, I was going to say, if anyone should have one, it should be you.
Yeah.
So
we do have it. It's part of the collection. We have 9. The reason why we released it is because, and this was years ago, but people asked us, okay, I don't have a functional medicine doctor. What are the core things that you see on labs to be beneficial?
Yes.
So that's why we released it. It's just, we don't really market it. It's just there.
What are the core things?
It is a probiotic. It's a multi-strand blend of lactobacillus and bifidobacterium, which are really well tolerated and can really help people that have digestive problems.
Okay.
And there's the magnesium.
Okay.
Magnesium deficiency is so common.
I was going to ask you about that. I want to ask you about that. You said, and also digestive enzymes.
Yeah. Digestive enzymes. Digestive enzymes are not in the collection because I wouldn't say everybody needs them. But
who does go on them then?
People that have hypochlorhydria or decreased hydrochloric acid, which a lot of people with SIBO have that. It's basically lower HCl production. It's causing putrefaction of things like proteins.
In English, please.
Malabsorption. Their body's not breaking down protein, especially people that have been vegan or vegetarian for many years, and some people that are just regular omnivores that are not breaking down protein. And then they think, okay, meat isn't for me, but it's really your low HCl production because of your bacterial overgrowth. So digestive enzymes can be used, in my opinion, temporarily while we actually get your gut to do its job.
Oh, got it. Because there's a lot of, what is it called when somebody is not their body is not absorbing the nutrients of the food. What's that?
Malabsorption or maldigestion.
Okay, so that's when you should take this digestive
Yeah, and you
enzyme.
don't have to be overtly an extreme malabsorption, like malnourished person to benefit from it, but it exists on a spectrum. Maybe you could have functional malabsorption issues, and we quantify these things on labs. But if people see undigested food in their stool, if they feel like bloating, then yes, digestive enzymes can be a tool.
Got it.
And that's going to be things like lipase and protease and amylase and breaking down proteins, fats, and carbs.
Perfect. Okay, so in your 9, there's magnesium, you said, because people
Yeah,
have a lot
magnesium, methylated B vitamins are in there. I mean, that's very, very important for people to either get it from food at the very least, but supplementation can help many of us.
Wait a minute, you said something about magnesium. I just remember something I wanted to ask you. There's 2 different things. There's magnesium and there's another magnesium that people talk about.
There's actually many types of subtypes of magnesium.
Okay.
Magnesium threonate is a blend of different magnesiums, which helps with bioavailability.
Okay.
So magnesium glycinate, magnesium threonate, there's magnesium oxide, there's tons of magnesiums. But they all have their own strong suits as far as how the body utilizes them and the bioavailability of them.
So
the body doesn't store much magnesium. So taking it every day can be beneficial. And it's really important for our parasympathetic nervous system and our digestion.
So then the magnesium glycinate, do you know what that is? Of course you do. When do you take, what is that then and why?
That's in the blend that I mentioned too. So it's a magnesium glycinate or glycinate. It is well tolerated. I'd say it's well tolerated. And it's one probably talked about the most.
Yeah.
There's the magnesium, I forget the one that's in the natural calm. It's magnesium citrate, sorry. Magnesium citrate or citrate.
That's the most common one.
Yeah, probably because everyone's buying that one product. And it does increase GI motility. So if people have a little bit sluggish bowels, I see people doing that. But look, again, my job would be why do you have the sluggish GI motility in the first place?
Right.
Magnesium deficiency could be a part of that. But the problem is those magnesiums that increase the bowel movements, like magnesium citrate, they tend to not be as well stored in the body. So I have patients that meet me for the first time and they've been taking magnesium citrate for years and their magnesium's still low. So you need different compounds of them, in my opinion, for most people to get actually the magnesium RBC, a biomarker that we run via blood, to actually be optimal, i.e. your body having it in the cells to help your nervous system out.
So in the 9, does that mean that people should be taking it every day? Just a plain magnesium.
Yeah, I would say most people, if I look at the ubiquity of magnesium deficiency, it's almost everybody.
Okay. And so magnesium, you said the other thing about, name the other ones then.
Vitamin D3, K2, which is a no-brainer, right?
Right. The K2, by the way, I know that, and then most people don't take the combination ones.
You're right. It's the super savvy people have, but yeah, it's because they see the D3. It's the one that gets all the attention.
Exactly. And so most people I know who think they know their health, inside and out, they're not taking the K2 piece.
Yeah. And all fat soluble vitamins, I think, are something to be mindful of. I would recommend getting some of the other ones from food, like vitamin A specifically, but it's hard to get vitamin D from food. So you supplement or get some healthy sunlight, and maybe some, mushrooms have some vitamin D, ghee has some vitamin D, fatty fish have some vitamin D, but small amounts, right? You're really going to get it through sunlight or supplementation.
Also, I should say that when you go anywhere, Amazon or whatever, you don't really see very often vitamin D with K2. That's it's also not as common at a store or at a place to purchase.
Yeah, they buy them separately.
They buy them. Is that the best thing to do? Is buy them separately?
We combine them, but I think you're right. The people that are mindful of it typically are buying them separately,
and then they combine. So, how much of the vitamin D should you have, and how much of the K2 amount should you have to make it a good supplement? It
depends. The K2 can really vary on the person, but vitamin D3, I would say, if I'm looking at the average person's labs, it's about 5,000 IUs.
Yeah.
You can do 2,000. And what I would say is this: if you're going to take 5,000 IUs, I would get your levels tested pretty periodically, every 6 months or so, because you may not have to be on 5,000 IUs forever and ever.
It's so funny you just said that, because I have friends who, it's not like less is more, it's more is more and better is more, are taking 20,000, 10,000. And that you can also be poisoned by vitamin D, I heard.
It's fat soluble, so it's stored in the fat and it doesn't clear out as well as the water soluble. So yeah, I have patients having to go off of like these mega doses of vitamin D.
It's crazy.
And they're just like, yeah, more is not always better, specifically with fat soluble vitamins like vitamin D3 and vitamin A. That's why food is so a great thing to start with, right? I mean, vitamin A you can get from food, but with vitamin D, it's really not something. So I would be mindful of continual high doses of any vitamin D3. But look, I am more concerned with vitamin D deficiency than I am with high vitamin D.
You are, okay.
Yeah.
What are the other ones then? Is there did we miss any?
Yeah, well, there's 9. I again, not the best marketer of it all, but
Apparently not.
There's an
Solomon, I
adaptogen.
think you got another job on your hands.
Rein me in. Tell me what to
Jeez,
say.
exactly.
So, there's an adaptogen. I'm such a fan of adaptogens. I usually talk about them in the book.
You don't have to tell me that. I know. It says tips on calming our nervous system. Adaptogens: holy basil, lion's mane, ashwagandha.
Which is why I put it in one of the 9 in the collection too. Because it's
Okay.
a blend of adaptogens that helps to modulate our parasympathetic nervous system. Mainly, this one is modulating the body's stress response, which in turn supports the parasympathetic nervous system. So it's supporting the hypothalamic pituitary adrenal axis, or the brain adrenal stress response, which is the main hormonal stress response that we see.
Oh my gosh.
So yeah, adaptogens are throughout gut feelings because it's something that I use in patients' protocols. So of course I'm going to talk about it.
So ashwagandha as a supplement, is it something we could take every day to help calm our nervous system?
Yeah, it's not necessary to take every day for everybody, but yes, if someone's going through a stressful time in their life,
Or they're just normally anxious?
more prone to anxiety, because some people do have different methylation gene variants
Right.
that we quantify on labs that make them they're more prone to that sort of anxiety or stress response. Or
And it helps?
yeah,
Really?
you can take breaks off of it and go back to it. It's not something you have to. It's not like someone has an adaptogen deficiency like vitamin B or vitamin D, but it's an herbal tool to support the nervous system and the endocrine system.
What is I thought lion's mane was great for your focus and brain.
It is.
Yeah.
So it's a medicinal mushroom, which has some adaptogenic properties because the brain is what's modulating the endocrine system, right? So it's actually improving nerve growth factors of the brain. It's been shown to improve neuroplasticity, actually helping the brain make new neurons.
Oh wow. Yeah.
So it's not just shaving a mane off of a lion, and it is a mushroom. Don't do that.
Yeah, please don't do that.
Yeah, don't do that.
And then holy basil, like how do you buy that? Do you buy that in a supplement form?
That's second Canadian thing that we heard today.
Yeah.
Basil versus basil.
Oh
I
yeah.
love it. I love it.
Basil? How do you say it here in this country?
Basil.
Basil. Well, you
But
say basil or basil?
I say basil.
I say
But
basil.
you say basil.
Yeah.
Tomato.
Tomato. Let's
Z
call
and
it
Z.
exactly.
Yeah.
Oh, I love them. So
Yeah.
cute.
And aluminium and aluminum.
That's right. Oh my God.
I have Canadian family.
Okay,
so we
how
know
about what
what's
do you
up.
say about the sink? I say garbage disposal.
We would say garbage disposal.
No, I'm not saying that. Garburator. I say garburator.
Garburator. I never heard that one
Yeah.
before. Wow.
Garburator. You don't say that there. here.
Garburator?
Yeah.
No. It sounds so like 1950s, like Jetsons.
I'm 140. Yeah, I mean that was what there's so many of these little words that we can have a whole other podcast about. But okay, so holy basil, you said or basil, whatever. Do you buy it in a supplement? Do you just eat it in like what is it?
Well, yeah. Well, you could. If somebody lives in India and wants to go forage for holy basil, tulsi, they
First
could.
of all, you can what do you call it? You can plant a basil plant in your
Yeah.
backyard.
It's not the same plant,
Okay.
but you could grow it.
It's not the same plant.
It's not the same
Okay.
plant as basil or basil, but I don't know anybody that grows adaptogen like that. Like more
No.
of the tropical ones.
Right.
You can do some other ones, right? But I don't know how they would grow in certain climates. Probably here in Southern California, you could.
Yeah, whatever. But what is it though? What does it do? The whole
It's a plant that's been used in Ayurvedic medicine, or it's also known as tulsi or holy basil.
Oh, okay.
And it's known as the queen of adaptogens. It's been used for thousands of years in traditional Indian medicine to support stress and your body's resilience. So it supports that circadian rhythm between the brain and adrenal glands, similar to ashwagandha, which most people have heard about ashwagandha, which has also been used in Ayurvedic medicine for a long time. So they're typically found in teas, in tinctures, powders, or capsules.
Okay, and so we should take if to calm our nervous system, we should take all of these, right? The holy basil, the
Well,
basil, lion's mane, ashwagandha.
no, you don't have to take all of them. So sometimes blends can be great because it's a sort of a synergistic benefits of it. And there's a lot of sort of curation. And that's sort of the art and science of, I think, of herbalism and what I do in functional medicine. But look, I think there's some merit to saying, no, let's just, if we want to keep things simple, let's just, if the study was done on X amount of milligrams of whatever adaptogen we're talking about, let's just try one and see how we
How it
feel.
works.
So you don't have to have all of them because they all in some ways are really doing similar things. Some have some hallmark things like you mentioned, lion's mane. Some of these medicinal mushrooms have some extra neuroprotective benefits that haven't really been researched in the other herbs, but they all have their strong suits, I guess is what I'm trying to say.
Got it. And then one thing you talked with the book, and I find this to be very interesting because I think this is what happened to me, is that you shouldn't be eating the same food all the time. You should have variety. So, like for example, I've been eating like eggs for breakfast for like 20 years, right? And I think I became allergic to it. Where now, when I went and got my test done, it was basically saying I'm highly, highly allergic. I should never eat another egg again, and that could be the reason why I have so many of these like skin, like eczema and stuff like that. Is that something what happens? Like you can actually make your body allergic to a food if you eat it too often?
Higher immunoreactive foods, there's the potential to do it. And eggs, the albumin in the egg whites does have the potential to do that. I'm saying that in the book mainly from a microbiome diversity standpoint.
Okay, not for the alert.
We could talk about that because it's important. But I just wanted to have someone have a diverse microbiome, and the different foods that they eat, the more diverse your microbiome is going to be, which is associated with longer, healthier life, less inflammation, better brain health.
Right.
And because you have better gut health. But that's an interesting point, and I'd be curious to see that test that you ran.
I would love to show it to you.
Because was it an actual allergy test or was it one of the sensitivity tests?
One of these very well-known nutrient, like he's like the top nutrient, like he's like from he's from NASA, and then he like now does all the sports teams and sports athletes. He took a panel, like I don't know how many thousands of like things, and it came back saying what I'm deficient in and what I'm not deficient in. I'm like, apparently I'm really like deficient in a lot of things that I never even knew, which I think a lot of people that would happen. But the eggs was like really surprising because I eat them so often.
And that's typically because of some intestinal permeability or leaky gut syndrome. So I would say, yes, eggs can be inflammatory for some people. They can be reactive for some people.
And not even know it?
And not even know it, because it could be a source of inflammation. It's not that it's causing extreme, obvious digestive issues, but it's contributing to the larger level of inflammation, the cascade of inflammation that's in their body. So people have to kind of weigh, do I really love eggs? If it's not causing any obvious issues, can I, or just maybe mix it up? Because I see that sometimes when we do reintroduction, when we've gone off of eggs for a while, done some reintroduction, we're measuring antibodies to albumin, which is the egg white, which is the more problematic part of it as far as the inflammation part of it. Because there's molecular mimicry. Like the theory that the researchers are talking about is this case of mistaken identity when the immune system sees albumin leaking through the gut lining into the bloodstream, and it's similar enough in structure to our own proteins where it's creating this inflammatory response. That's what happens many times when you get a blood test. That's really what you're seeing is sort of some sort of IgG, some sort of immunoglobulin response to albumin. I don't have the lab that you got done, but that's typically how they're done. So my goal in that case would be just to let's heal the gut and reintroduce it. So I don't think people need to be fearful about eggs. Some people really have to deal with these upstream root causes.
Well, eggs are just mine, but it could be for anybody.
It could be any food.
It could be anything for anybody.
I see these people with these food sensitivity tests that have like 100 things positive. It doesn't mean you have 100 different food sensitivities. It's less to do about those foods and more to do with the immune system's overreaction to those foods. And they're typically, the ones that are positive are the ones that people just eat all the time.
all the time. Well, that's why I think there's like such a, in the last 10 years, everyone is like now gluten intolerant. No one was gluten intolerant like this 10 years ago, but
Yeah.
now because people eat so many carbs it shows up. But an intolerant and an allergy are not even the same thing.
Yeah, intolerance, sensitivity, and allergies are all different things, actually. So, and sensitivity and allergy are both immune mediated, meaning that the immune system's responsible for it. The allergy is what we know; it's the more of like the immediate response, and it is like it
Right.
can be very life threatening, right, for some people, but not always. And then the sensitivity is still immunoglobulin; it's still immune mediated, but it's typically delayed. It's typically chronic, it's typically like sublime in the sense that people don't really realize it. And intolerances technically aren't actually immune mediated. They're an enzyme deficiency. So a lactose intolerance is a deficiency of lactase, or any other intolerance. It's really an enzymatic deficiency, which is still a gut health problem, but
Right.
it's a production of the enzyme issue, not an immune system issue.
That's so interesting. And then I wanted to ask you this, and then we went into the ways for calming your nervous system. And that's what are some signs that you have a dysregulated nervous system?
Well,
And then I'm sorry, I'm in talking to you and talking to you.
well, I mean, look,
This is going on for like till tomorrow, by the way. So I have pajamas.
I mean, yeah, can we get in the Guinness Book of World Records? We should just see whatever the longest podcast is.
I mean, by the way,
5 days. Solomon said 5 days.
5 days. Well, wait, how long has this been? It hasn't been that long.
No, I just am joking.
Yeah, I know you're joking, but how long has this been? Oh, I thought it was like only 45 minutes. Sorry, Will. He's like stretching in the chair.
No, I'm fine.
Just a really funny side note, and then I'll ask the question again. But Mark Manson, do you know who he is?
No.
He wrote the book, The Subtle Art of Not Giving a Fuck,
Oh,
and like
I've
all
seen
those.
the book. Yeah.
Yeah. Anyway, he was here like last week, and he was here for like an hour longer before we even started, right? And then we were starting. He's like, by the way, how long? He's like, this is not going to be like a 3-hour podcast, is it? And I'm like, no, of course not. You'll be out of here in an hour. It was like 2 hours and 45 minutes. And we're still
Now you're that
going.
girl, right?
Exactly. I was like, oh my God. Anyway, sorry. Okay, so question being, what are some signs that we have a dysregulated nervous system?
I did, you know how people like quizzes? I adapted questions that I asked patients during an initial telehealth consult.
Yes, you do like quizzes.
And I adapted questions that I asked patients into a quiz. And it's on the website. So people go to drwillcole.com, just go to the gut feelings section, and there's a shameflammation quiz that's just really an amalgamation of different questionnaires that I ask patients. But if they want to get granular, they can take the quiz. But for the sake of today's conversation, I mean, look, if the question was a dysregulated nervous system.
Yes.
Yeah. So anxiety, I mean, look, anyone that has anxiety, anybody with depression, anybody that has an autoimmune issue, anybody that has chronic fatigue syndrome, anybody that has a metabolic hormonal problem, anybody that has a digestive problem.
Do you know what this sounds like right now? Do you know those commercials when
Yeah.
they like give you like a million different things that can go, like anyone who's tall, short,
Yeah.
blonde or
basically
brown, you
it.
know what I mean?
But it exists on a spectrum. Some people it's mild.
Yeah.
Some people it's very extreme.
Well, I love all this stuff. That's why, I mean, I can talk to you for hours, but I know you have other places to go. So
I love talking to you, like I said.
I
Master interviewer.
Oh, I love you for saying that. Where can people, okay, first of all, where can people find more? You just told people at willcole.com.
drwillcole.com.
drwillcole.com. The book is called Gut Feelings. You're all over social media and Goop, right? And what was I going to also say? Oh yeah, and people, you are seeing patients. You probably don't need any more though, but
we have the proper bandwidth of team. I still see all the concierge patients on group calls, initial consults. Yeah, that's my day job. So, but there are other options for people too. We have group class options, which I still see them weekly, and
group.
Yeah, we have group. We have concierge one-on-one, and we have group models to make it more accessible, affordable.
Really?
Yeah.
I've never heard of that. What do you mean?
Well, the Cleveland Clinic's Functional Medicine Center historically, and they opened up after, like we started before there was even a Cleveland Clinic Functional Medicine Center. But when they opened, they had a group model. And I don't know if they still do that, but I think that they have a long waiting list there too, and they're doing amazing things. And they tend to have a lot more group models. And that's something that I always knew, okay, this is one path for many people to further democratize this and get people access to it, to lower the costs for it.
Wow.
So they still have their individual health coaches, but there's a lot of the group things with me are via group. A lot of the sessions with me.
How does it work? Like there's more than there's 10 people on a screen?
There's lots of people.
Like how many in a
I mean,
group?
right now we have in just the group model alone about 250 people.
On a call?
Yeah. Not everybody joins every week because they're getting such good care from their coaches, but the calls are every week. So there's
wow,
dozens and dozens and dozens of calls with me. So they don't have to join every week.
And so what do? You go over topics of things or
answering questions, topics, just deep dives on things. Again, they still have their one-on-one coach. So it's a hybrid. It's not entirely group.
So when you say a one-on-one coach, like another functional medicine doctor who works underneath you, or
a functional diagnostic nutrition practitioner. So they're basically, you could call them nutritionists, health coaches within functional medicine. Yeah.
And then what if they want to see you?
So that would be the concierge side of things. So
Gotcha.
And
okay.
I still do that too. That's most of my day is that.
Oh, that's what you do. So what do you do with Goop? What's your relationship with Goop?
So Goop, just my friends.
They're just friends.
My friends, and my book is under
through the press. Yeah,
but,
that's it. Okay.
They were friends first before the book. So
okay, I didn't. But I thought you were involved in their website or something else.
The history's long, but the history, because I hosted one of the first Goop podcast spinoff. It's called Goop Fellas.
Oh my! Whatever happened to that?
They need to bring it back. I have my own podcast now. It's called The Art of Being Well.
Yeah.
It lasted for about a year or so. I just think the pandemic happened, right? And I think they just readjusted how they were doing and their focus on the podcast side of things. And Seamus Mullen's still a friend of mine. Everybody at Goop's still a friend of mine. It's just the podcast, we never revisited it. And we're all busy doing different things.
Right. And was it just for fellas then, or?
No, it wasn't. It was for everybody. A lot of women listened to Goop Fellas.
But maybe the problem was it was named, the branding was off. People thought maybe women who listen, or majority of people listen to podcasts, they were scrolling and they're like, oh, this isn't for me. It's for fellas.
Well, that could have been it. But here's the deal with that is that Goop, what it is still, really does a lot of things for men. And I think it was their way to bring in more people to the conversation.
Oh, I remember that now that you said that.
Yeah, Blast from the Past, 2019.
Yeah, 100%.
Yeah, and so they're just that's my relationship with them. So I write for them occasionally, and that's about it.
Oh, okay, well.
I don't work for Goop.
No. I know you don't work for Goop. I mean, because even on your press stuff, it says something about Goop, and I was just like,
Goop Press. Yeah, it's the Goop Press. It's the book is Goop Press.
I understand all that stuff. Oh, I understand. Well, this has been very, very enlightening. I appreciate you being on this podcast as usual. You're a wealth of information. I have a million more questions, but you can just come on again next time.
Thank you so much.
Yeah, this is amazing. Thank you, Will.
Thank you.
Bye.